Corpbiz.
Hello friends, my name is Srishti Pandey and in this video I will discuss about CDSCO guidelines for medical device import. CDSCO stands for the Central Drugs Standard Control Organization. It is basically a national regulatory authority which is operating under the Directorate General of Health Services, which is Ministry of Health and Family Welfare, Government of India. Medical devices are freely imported into India. To ensure the quality of the product being imported into the country, Government of India has developed regulations and guidelines for the same. Let's first see what is medical device. Any instrument, apparatus, appliance, software, implant, reagent, material or other article intended by the manufacturer to be used alone or in combination for human beings for helping in disease, injury or disability, replacement or modification of anatomy or for providing information by in vitro examination without pharmacological, immunological or metabolic. Medical devices are broadly divided into two parts, which is notified and non-notified medical devices. The CDSCO also classify the medical devices as per the risk parameter and intended use, that is class A, B, C and D. Class A medical devices are low risk medical devices, class B is medium risk, class C is medium to high risk, class D is high risk. Medical devices entering into Indian market must be in compliance with the guidelines set forth by the CDSCO. All medical devices imported into India is required to have medical device import license. If any medical device are imported into India without getting registration, it will be considered as violation of Indian law and thereby invite penalty for the same. There was an amendment in medical device rule in 2017 in February 2020 referred to as medical device rule amendment 2020. Now all the devices, whether notified or non-notified, requires CDSCO registration. Now let's see the application procedure as per the CDSCO guideline. An authorized agent having a valid license to manufacture for sale or distribution or wholesale license for same can apply for an application for grant of import license for medical device to the Central Licensing Authority online in form MD14 on the portal of Ministry of Health and Family Welfare for obtaining a license. If the Central Licensing Authority has a reason to believe that the quality of the medical device has been compromised, then it is subjected to go through the test and evaluation in the testing laboratory as specified by the Central Licensing Authority. After evaluation of the application form and documents, if the Central Licensing Authority is satisfied, it will grant a license to import in form MD15. If the authority is not satisfied, it may reject the application and the reason for rejection is required to be recorded in writing within 9 months from the date of application. If the application is rejected, an applicant make an appeal to the central government within 45 days from the date of rejection, and the government, after an inquiry in this matter, pass an order in relation there within 90 days from the date of appeal. Now moving forward, let's understand whether components and accessories imported also require registration as per CDSCO guideline. As per CDSCO, components and accessories imported need not to be registered separately. However, what separately means is not clear. All components and accessories should be registered because in the registration form, Details of components and accessories are required to be filled. If any components and accessories are not registered as medical device for some reason, then they need to be registered as medical device as per the definition which is mentioned in the Act. The basic documents required for registration are an ISO 3485 certificate, certificate to foreign government of free sale certificate, and an undertaking stating that the information and documents submitted are true to their knowledge and are authentic. Let's see what are the consequences of non-registration as per CDSCO guidelines. A device which is required to be registered cannot be imported into India without registration after October 1, 2021. The importers need to get registration done before they import medical devices to India. Devices imported after October 2021, if not registered, will invite penal action under the Drugs and Cosmetic Act of 1940. In the last, we can say that with increasing demand for export and import of medical devices in and from India, government has been coming up with new policies to make such process easy and smooth. The registration for import of medical devices is mandatory to process, and it must strictly be as per the Central Drugs Standard Control Organization. Thank you. For more video, like and subscribe our channel.